cholesterol, Dr. Davidhizar, there is so much information out there, and apparently everybody has it, and there is frankly lots of different information out there. Go ahead and tell us your viewpoint about it, what we should be, taking care of, what should be doing.
Well, it's very important that you get your cholesterol under control. And unfortunately, most of the time when people have high cholesterol, it's not so much what they eat, although that's a part of the problem. It's a genetic problem. Their ancestors have passed on genes to them that produce too much cholesterol. So our bodies make cholesterol, even if we don't eat cholesterol. I have people in my practice who are vegetarians or vegans. They never eat a drop of cholesterol, but their cholesterol is too high. That's because your liver will make it. Even if you don't eat it, because we need it for building blocks. Most of our hormones are made from cholesterol as a base particle or molecule that they're built on. So we need some, but the problem is most of us have too much. Long ago when we were, farming and cutting down wood to heat our house, people burned up that extra cholesterol, and so it wasn't a big problem. But nowadays we're much more sedentary, so the cholesterol, instead of burning it up, it gets deposited in our arteries, causes atherosclerosis, which leads to heart attacks and strokes and many problems. So the important thing is to get that cholesterol under control, and it's hard to do it with diet. We recommend that you do watch your diet, but frequently it takes some other treatment along with it. The important thing about the cholesterol is to try to get your good cholesterol, HDL cholesterol, that's your high-density cholesterol, that's your good cholesterol. You want that as high as possible. And, that you can increase by exercise and also by eating salmon or fish that is high with omega-3 fish oils. Those all help bring that up. And just exercise will help lower your total cholesterol as well. So those are all important things to do. In my practice, I'm very strict on how low I want the cholesterol to go. Most people are too lenient, and they say, 200's okay. Well, it should be more like 150. People are still having heart attacks at 200. Very few heart attacks occur at 150. But it's actually the ratio between the good and the bad. So the higher we can get the good cholesterol, the better in the long run anyway. So there's some natural ways to bring it down, which we recommend to people as well. Niacin helps, flaxseed helps. There's some natural fiber drinks you can take that also lower your bad cholesterol, bring up your good cholesterol. So there's many ways to attack it, but the important thing is to get it down under, in a normal range so that you don't have all these complications that occur from, heart disease and high cholesterol.
Right. Well, it looks like exercise definitely seems to be, if exercise would be a prescription, I guess you would be prescribing it a lot, like, it seems like a cure for lots of things. Now, tell me, lately in the last few years, I have, heard in connection with high cholesterol and its danger, that buzzword called C-reactive protein. How does that fit in? Is that one of those good things you're talking about? Part of the good or the bad cholesterol? Anyway, what role does that thing play? That the word seems to be out there.
Yeah, well, C-reactive protein is just a test to determine how much plaque you have in your arteries. C-reactive protein measures inflammation. And so anytime you have inflammation, your C-reactive protein is going to go up. So if you have a bad infection of some kind, your C-reactive protein is going to go up. Certain kinds of, we were talking about arthritis. Arthritis usually has an elevated C-reactive protein as well. Anything that affects inflammation in your body will make that test go up. So the C-reactive protein, we have no other reason for having a high score. You don't have an infection, you don't have any chronic diseases that cause it. If it's elevated, that's a warning sign that you have too much plaque in your arteries. So we're using that more and more to determine who is at risk for a heart attack and a stroke. So it really is, it's just a test that tells us what's going on.
So, high cholesterol, does it equal high C-reactive protein or not necessarily? And if let's just say a person has normal cholesterol but has high C-reactive protein, is that another indicator? Shed some light on it.
Yeah, you can have high cholesterol without having a high C-reactive protein. Depends, there are some types of cholesterol that even though they're high, don't seem to cause as much trouble. So, and you can tell those by the special tests. So the C-reactive protein, like I said, doesn't necessarily mean you have high cholesterol. But if you're forming plaque, it'll be elevated. So that's the important part of it. It's sort of a gauge, along with your total cholesterol. If you also have then high C-reactive protein, we think you're at much higher risk for a heart attack or a stroke.
I see. So if you have high cholesterol in itself, that's apparently not a good thing. But if you at the same token also have a high C-reactive protein, then that's really bad. And at the same time, if you still have a low C-reactive protein, that might mean that your high cholesterol is not as vicious as somebody else's one.
True.
Did I get that right?
You got it perfect.
Okay, wonderful. So do most doctors test for the C-reactive protein when they test the cholesterol and all that stuff? Is that part of a standard routine examination?
I don't know if it is for some people yet, but it's becoming that way. It's a special C-reactive protein, actually. It's called C-reactive protein cardiac. So it's more directed towards just the cholesterol and the plaque aspect of the vascular disease. You can just do a regular C-reactive protein, and it won't tell you as much. But I think more and more physicians are including that now in their evaluation for heart disease.
All right. So a patient who gets an examination for cholesterol, and for that much, just a normal, big, good, thorough health examination, should ask for it.
True.
Absolutely wonderful. Thanks a lot.
You're welcome.